I'm Carole Taylor. On this episode of Journal, we tell the remarkable story of Marshall Smith, former Chief of Staff to Premier Danielle Smith, and the man behind Alberta's dramatic turnaround in its approach to drug addiction and treatment. What makes Marshall stand out is that he was once one of those individuals we see sleeping on the streets of the Downtown Eastside in Vancouver. As an addict, he's been beaten up repeatedly, put in jail, threatened. What makes the story even more meaningful is that he came from a modest family, worked his way up to a position in the BC government, and even served as part of the successful Olympic Committee. He was in a good place. And then came the Vancouver Sun headline, BC political aide caught in drug raid. That was in 2004, and that's when the spiral downward began. Fortunately, this riches to rags story has an enormously happy ending. After being told that it was treatment or jail by the police, Marshall, with a lot of help, was able to overcome his terrifying addiction. This lived experience is the reason he's so passionate about making drug recovery the focus of provincial addiction initiatives, rather than solely concentrating on harm reduction. Of course, as you can imagine, this approach is controversial in those circles promoting safe injection sites, free drug paraphernalia, along with a safe supply of drugs. Some even want to call the so-called safe supply to be distributed even without a prescription, taking away a possible point of intervention by a doctor. So what can we learn from the Alberta model that could be applied in British Columbia? We are back in a moment with Marshall Smith. Marshall Smith is certainly a voice to listen to when it talks about addiction recovery rather than just harm reduction. Thank you for joining us. And I think your story and the position and moves you've made are more important because of what you personally went through. And you were at one point an addict. So walk us through your story. Did you start your addiction in high school?
Well, it's great to be here, Carole, and it's great to be back in Vancouver. Indeed, I'm a person in recovery from addiction of about 18 years, and my story started like most people do in high school, drinking alcohol. I was pretty good at it. I think that the difference between me and my friends is when they stopped drinking, I didn't. And that went on for a long time. And of course, that persisted throughout my early career. That turned to drugs, when I was working in politics the first time here in British Columbia, which saw really a rapid spiral and deterioration of my health and sort of gave up my suit and tie and office at the legislature and vanished into the downtown east side of Vancouver. What
is it like on the streets?
Well, it's very dangerous. It's very cold. It's very uncomfortable. It's not a nice place to be. But there's also an element of really severe addiction to these substances which keep you there. There's not a lot of off-ramps, not a lot of avenues, to get out there, at least for me in the time that I was out here.
So you were thinking every day, probably all day, how do I get my next...
More drugs, yeah.
More drugs.
Yeah. That's typically what addicts want, is more, yeah.
And so how did you make the turnaround?
For me, it was, addicts will continue to use until the consequences of their using outweigh the benefits of quitting. And so for me, that point came when some members of the Vancouver police, got me and basically said, look, you go to treatment or go to jail, we'll help you do that. That was an easy decision for me at that point. I went to treatment. I enjoyed it. I took it seriously. And that was 18 years ago. I never looked back. I had a great experience in treatment, but it really took that confrontation of consequence, to be the catalyst for me to make that leap.
And so those police officers really were your saviors.
Yeah, they were great. I still know them today, and speak to them on a regular basis. And we've become quite good friends over the years. So.
Well, as you know, and you can see on our streets all over BC, we have got an enormous problem with mental health issues, and it overlaps with decriminalization, and it's quite awful.
Yeah. Yeah, the situation in this province and in other parts of Canada as well have been deteriorating for the last 15 years. And, there's been sort of a pervasive view of how we tackle addiction that has been really been, policy that has been driven by activist organizations, mainly based here in Vancouver, that have had outsized influence over the policymaking process, particularly in this province. And really you get out what you put in. So if you compare, for example, British Columbia and Alberta, in British Columbia, they largely have people who are currently addicts using drugs from the Downtown Eastside, the Vancouver Drug Area Union of Addicts, the Drug Users Liberation Front, all of these activist organizations that really enjoy quite a lot of influence over the policy-making process. And Carole, if you ask addicts in their addiction what they want and what they need, it won't be a surprise to you that they will say they want the police to go away, they want free drugs distributed by the government, and they'd like a free hotel room, right? And lo and behold, those are the policies that you're seeing emerge in this province. If you ask addicts in recovery to look back on their experience and advise on what they feel they needed to get where they are, they will tell you that they need to be removed from the drug-using environment, they need to have the drugs taken away, and they need to be supported in treatment, and recovery. And lo and behold, that is what you're seeing in Alberta. So this is really a story about leadership and about the choices that leadership makes in what advice and the people that they're listening to and how they form those opinions.
So how did these activists, especially in BC, get such influence? And even within the government structure, they have influence. How did that happen? Is it because the rest of us were afraid to stand up and speak?
I think that as a general population, there has been a prevailing attitude that the general population is just willing to sort of have this conversation led by experts, and which is fine to inform these conversations by experts. And somehow the drug user groups have anointed themselves expert, right, in that. And I think it's been wrong-headed to allow that to happen. And I'm not saying that we shouldn't listen to people who are homeless and addicted. Of course we should. We should try very hard to understand what it is that they're going through. But they are not a group of people who can be relied on to be making good healthcare policy. And that's a shift that is going to need to be made in this province.
So you were able to move into a position of authority in Alberta and try to change the approach to this situation. Is it only Alberta where you could have done it?
Well, look, at around 2015, I authored a report called Strategies to Strengthen Recovery in British Columbia. It was a 39-point plan for system transformation of the way that we approach the addiction care system in this province. It was published, it was widely covered in the media, and it was called The Path Forward. The government of the day was not interested in implementing that strategy. Instead, they wanted to continue on and deepen their harm reduction model. That report is now what we refer to as the Alberta model. And so, we were sort of recruited to come to Alberta by then Premier Jason Kenney, who was very interested in making some big systemic shifts in Alberta. And so we've been very diligently executing on the system transformation that we have going on there. And what it has become is quite literally the largest systemic transformation of addiction care on the planet right now. So we're very proud of the work that's going on there. But I think what it shows is that there is a path forward, right? There is a way to reform these systems, but it takes quite a bit to do it.
And it takes leadership, as you say.
It takes
One
leadership.
government said not interested, and others said interested.
Yeah.
So before we get to the specifics of what your model is there any place for harm reduction in that?
Absolutely, for sure. And the Alberta model includes harm reduction. We do have harm reduction. We believe that we do harm reduction better in most cases.
Why is it better?
Well, it's a much more regulated and controlled model that has to have outcomes attached to it. So, for example, we have supervised consumption sites in Alberta, just as you do here in British Columbia. Ours are regulated by the province in addition to the federal government. Ours are run by healthcare professionals. They're run by, in most cases, the health authority, with healthcare professionals who work inside of there. They have to be trained. They have to be accredited healthcare staff. They have to have criminal record reviews. We collect the personal healthcare number of the individual who is coming in to use the site. We treat them like a vital healthcare service. There's also requirements on those sites to refer the people who come in to treatment and other services, and to keep records of all of that. And as a result, after we did that, we don't have the chaos and the community disruption that you often see. In British Columbia, most of those consumption sites are run by activist organizations. Many are infiltrated by organized crime, often dealing drugs, within the sites, and that needs to change.
That's really depressing to hear.
Yeah.
We'll be back in just a moment. Marshall Smith has been leading an amazing transformation of how addiction is dealt with in Alberta. What are the major themes that you would say that would drive a change?
Sure. I think one is a fundamental belief that people can recover, people have the right to recover, and that we want to have an environment in Alberta that is the most mentally fit, least addicted jurisdiction in Canada. That's what drives us. We also want to have a fully connected system of care. So this isn't a debate over whether or not recovery is better or harm reduction is better. The initiative in Alberta is really about putting the system in place and sewing those pieces together so that an individual can easily navigate that system of care. One of the other major parts of this is ensuring that you have enough capacity of care. And of course, for decades now, in this province of BC and Alberta and other jurisdictions, we haven't cared about this issue, right? We have cared more and more lately because of the crisis that's occurring. But for decades, we haven't put the capital resources in place to build out the capacity that we need. And if you don't build the capacity that you need to treat this serious healthcare issue, people are going to pool up on the sidewalks and the streets with untreated addiction all over the place. And so this is a simple, not easy solution, which is build more care, get people off of the streets, and most of them will go voluntarily when that capacity is there. In Alberta, we're building 11 high-capacity, long-term addiction treatment centers, almost 1,000 beds of capacity, capable of treating an additional, many, many thousands of people a year, in addition to the legacy system that is there. These are brand new investments that we're making. 5 of them are in partnership with First Nations all across the province. We made access to our addiction treatment system free of charge because we believe that no parent should have to take out their credit card, and take a $25,000 charge to get their loved one into care or sell their car or put a second mortgage on their house. These are vital healthcare services and they should be available to people. And so the government of Alberta, funds all of the treatment in Alberta. All you need to do is swipe your care card and you can go in.
You said something important, long-term care, because I think often people think, well, if you just have a few more beds and
right.
People come in, they get sober and off
right.
you go and
right.
good luck.
Yeah. So much of the models of addiction treatment over the past decades have been modeled after a 35-day program or a 45-day program. And of course, we know that for most people, that's not adequate. So our new recovery communities in Alberta are individualized care up to 1 year. So the individual can come, they can do intensive treatment, and they can stay for a lengthy period of time if that's necessary. But it's very different for everybody. It has to be a unique, tailored experience for each individual.
So what's the experience like? It's not like hospital beds all in a row?
It's not. These are beautiful facilities. We just opened our latest one in just outside of Edmonton called the Lakeview Recovery Community. It's a 40-acre facility with, about 40 buildings on it. It's a small town, and there's currently slated for 75 clients there. It can go up much higher than that in the future. Most of these facilities are capable of handling 75 clients. It is a small community. Everybody in there has a role to play. They are there to live recovery, not simply passively receive treatment, right? They're there to practice living life clean and sober.
So what services do you provide?
Inside those facilities? Well, they have group therapy, they have one-on-one therapy, they have all the things that medical services, opioid replacement medications. It's really quite a large evidence-based process. But we involve the clients a lot more. It's a less paternalistic and more involved process for them. It's very important for people who are entering early recovery to learn how to live life, clean and sober. These are places of life learning. And so, our model is really less about harm reduction and more about life promotion. And so everything that we do in the model, we have a guiding principle that if it's something that is going to drive disconnection, we don't do it. Everything that we do has to drive connection and to drive connectedness within people, to give them purpose and to give them hope and to cheerlead them along the way.
What if someone just doesn't want to go into treatment? Do you in Alberta, are you able to secure them into
Well,
care?
that's coming. I mean, let's be clear about the conversation of involuntary care. I think the reality is that most people with addiction who enter treatment do so under some form of duress, whether that comes from their parents, their workplace, the law, their healthcare status. I've worked in treatment a long time. There are very few patients that report to treatment who woke up one morning, threw open the drapes and said, today is the day. There's almost always some consequence that they face in order to get them to go. Our model will always be based on voluntary care, right? Our model will always be based on people, going in voluntarily. But I think that we have to recognize, and there are difficult conversations happening across the country right now, that there is a population out there who have seemingly lost the capacity to make good healthcare choices for themselves. Many of them are dying, some of them right in front of us on sidewalks. That is not compassionate. It is not compassionate as a community to allow people to languish in tents, overdosing, and dying under those circumstances. We have to do more to intervene, and we will do more in Alberta.
It must be, I think, up to political leadership at some point. You, as you said, you did this report, but until someone in political leadership bites and says, yes, I'm going to stand up and do it. So tell me about your leadership, governance.
Well, look, in Alberta, our system transformation is very much led by the Premier and the Minister of Mental Health and Addiction. We have a cabinet committee that is a small version of cabinet, and its job is to guide health system transformation. In all of those ministers who are responsible for the transformation, they have a mandate item in their mandate letter that requires them to transform the policies of their ministry to a recovery-oriented system of care. So they're held accountable for those outcomes. We're having very, very good outcomes, Carole. If you compare If you compare overdose fatalities in May of 2023, last year, in Calgary, for example, we had about 70 overdose fatalities. In May of 2024, this year, we had 17. So significant reductions in overdose fatalities. I think overdoses broadly in Alberta are down about 55% year over year. So while we're not taking a victory lap, it is certainly cause for optimism. And those fatalities are down across the board. It isn't just opioids. It's alcohol, cocaine, benzodiazepines, the spectrum of substances. That's what happens when you make treatment widely available. People access it, they get treatment, they go on to live great, successful lives, and the evidence of that is all around us. And so we have to get busy building out that system of care. I wish British Columbia the best, and look forward to working with them. I really think that we need to have a Western Canada solution. I don't think that we can afford anymore to do this sort of battle of the Rockies, which is better. I think that there's a lot of good work that is going on in British Columbia, and I think that the two provinces need to begin talking to each other more about that.
Are you about to make an announcement? Are you
No,
coming to
I'm
BC?
not. I'll be around a little bit more, but I look forward to those conversations.
Thank you for all that you are doing, and hopefully we'll do here as well.
No, you're so welcome. Good to see you, Carole.
We'll be back in a moment. Let's hope we're at the bottom of this dreadful problem of addiction in our cities. We now have a chance to shape our way forward. It's important to listen to voices of those who've been there, voices like Marshall Smith, who argues we mustn't give up on addicts. We must offer them a compassionate way to recovery. Let me know your thoughts on YouTube. Till next time, I'm Carole Taylor.